My name is Greg Weiss, and I heard about the practice through my insurance company. I did a search and pulled up Dr. Johnson's name. I then contacted my prior back surgeon and asked him if he knew Dr. Johnson, and he said he did, and he came highly recommended, and that's when I called the center. I came to the pain clinic because I was in a lot of pain after 2 rear-end car accidents 3 years apart. I could never get comfortable sitting on the couch. The pain started within 5 minutes of me sitting, and no matter what I seemed to do, it was still prominent. And my pain was not going away. It was getting worse and worse, and that's why I had contacted the center.
Greg's condition was chronic low back pain secondary to a motor vehicle accident, actually. He actually suffered 2 motor vehicle accidents, and he had undergone lumbar spinal surgery. Still was having significant pain, and unfortunately was in a second motor vehicle accident and suffered worsening symptoms, new injuries. Yeah, we took a comprehensive approach with Greg. He had tried multiple treatment modalities in the past: medications, physical therapy, interventional procedures like surgery, less interventional procedures like injections, and none of it was permanent or long-standing or long-lasting, and hence he was a good candidate for spinal cord stimulation.
Dr. Johnson had presented to me some options. One of them was the spinal cord stimulator. Explained to me what it was about, gave me a packet from Medtronic so that I could go home and take a look at it, discussed it with my wife, and pretty much felt this was my option of where I had to go.
So the spinal cord stimulator works by inhibiting nerve signals or neural impulses from getting from an area of the body that is receiving impulses and transmit those impulses to the brain, where the brain perceives those impulses as pain. This essentially overrides those signals using electrical impulses. The nervous system, which conducts pain, is essentially a bioelectrical system, so we use electrical stimulation to improve or resolve pain.
After having the spinal cord stimulator implanted, I was absolutely amazed at the things that I was able to do again in my life. I felt fantastic. It's the first time I had been pain-free in a very long time. I was able to, once I got past the restriction period, I was able to pick up my golf clubs again, which I had not been able to do for almost 2 years. General things around the house, things that you kind of take for granted that you can and can't do, pretty much able to do completely. The whole experience in coming here was very good. Everybody at the desk area was very friendly and very helpful. And then when I saw Dr. Johnson, he's very compassionate, he's understanding, very sympathetic to what my pain was. There is no ego involved with him at all. He's very down to earth. He explains things so anybody can understand them. Anytime there's questions, he's very open to answering questions, and it's just a very comfortable situation. I would definitely recommend Dr. Johnson and the pain management group. In fact, I have told 2 of my physicians about it. They've taken his information to use for potential patients that they might have. I've also talked extremely highly with a lot of friends that in the event they need to go there, that's the place to go.